Hey guys, my name is Brie Scott. I'm a nurse. I work here in the Bay Area. My specialty is neuroscience. Your wonderful teacher, Miss Crosby, she asked me to make a video for you guys with a little bit of information about what nurses do and what is neuroscience, and then a couple cool stories for you guys. So, first, nurses are responsible for managing patient care. What we do is take care of 3 to 5 patients who've come to the hospital for different sicknesses. Some people have pneumonia, some people have had heart attacks, some people have had strokes, which I'll talk about later. And we're responsible for providing them with everything they need, from helping them go to the bathroom, which isn't so fun, or giving them medication and keeping their vital signs stable, like their blood pressure and their heart rate, making sure they're breathing comfortably. Um, and then it goes on to complicated things like looking at some of their blood work, like their blood labs that show you different levels of electrolytes in their body, and um, our responsibility is to keep everything balanced and give their body optimal environment to heal. So nursing requires having a bachelor's degree. That's a 4-year degree. I'm sure you guys know what that is. Um, I'm working on getting my bachelor's degree now at Sonoma State. So it is possible to work as a nurse before you have a bachelor's degree, but it's required to have one at some point in your career. Some nurses can get master's degrees, and you can become what's called a nurse practitioner, where you basically act like a doctor and you work in an office and you see patients. They come visit you just like you would see a doctor, and you can prescribe medications and do anything a doctor can do. And some nurses even have doctorate degrees, PhDs. And those nurses are typically working in government. They help to create public policy around healthcare. And some of them are educators or deans of education, or they run entire schools. So nurses with doctorate degrees are typically pretty high up in the ranks. But just to be a normal nurse, you need to have a bachelor's degree. So for me, I was interested in nursing because I'm interested in the way the human body works. I definitely find it exciting when people are kind of really sick, and it's my job to help make them better. So it's a good job if you like to, if it doesn't gross you out to see, body fluids, if it doesn't gross you out to see sick people, and if you like caring for people, it's a great job. So, neuroscience. I work in neuroscience. I take care of patients with mostly brain and spinal cord injuries. So, a lot of the people I take care of have had strokes. And what a stroke is, if you don't know, is similar to a heart attack, but it happens in the brain. Um, Part of your brain loses oxygen due to either a clot in a blood vessel or a broken blood vessel, which causes a bleed. Your brain loses a little bit of oxygen in one area, so you stop functioning as well. And so my job is to take care of these people and teach their families how to take care of them now that they've had a permanent injury, and to help them emotionally cope and rehab a little bit. Excuse me. So, I also take care of patients who have had traumatic brain injuries, like people who've been in car accidents, or people who have been in accidents like biking accidents where they've broken their spinal column and had injury to their spinal cord. So sometimes my patients are newly paralyzed. When you have an injury to your spinal column or your spinal cord, you can become paralyzed, a paraplegic or a quadriplegic. So I take care of a lot of people like that. So overall, brain and spinal cord is what interests me the most, and I know you guys have learned about that recently. So I think a few of you now to get into some gross stories for you, because that's probably what you're interested in. I think a few of you have seen a photo of this leg that Miss Crosby probably showed you. If she hasn't showed you, make sure she shows you. um, I get to see a lot of kind of gross stuff. People's bodies, when they're sick, um, it compounds. You get one little thing happens, and it just leads to a new thing and a new thing and a new thing. So this leg, I took care of a young guy who cut his leg while he was out drinking at a bar, and he ended up having to get his leg amputated after quite a long journey for him. He developed a flesh-eating disease that turned his leg necrotic. Necrotic means dead or dying. The tissue on his leg was dying, so his leg turned black, and um, we had to eventually amputate. So he was a very young guy, 24 years old. So now he's got to live out the rest of his life with half of a leg. So you never know what could happen to your body. Um, I am with another gross story for you. Let's see. I became a nurse because I wanted to deliver babies. That's what I thought originally. But when I was a nursing student in school, the first time I saw a live birth, it just grossed me out so bad that I fainted right in front of the mom, right when the baby was coming out. I fell right on the ground, and I didn't come to for about 10 minutes. And by the time I woke up, the baby was already born, and everybody was oohing and awing over the baby, and I was really lightheaded. So, um, everybody in healthcare has their specialty. Everybody in healthcare has something they're interested in. And for me, that just wasn't babies. For me, it was neuroscience. So, I would say if you're interested in healthcare, interested in nursing, definitely check out what the degree requires. You have to get 4-year degree, like I said, and you got to be pretty good at science and memorizing things about the body, the human body, and you also got to be a really good communicator. Nurses are kind of like managers. We are responsible for coordinating with doctors and therapists and um, home health and all kinds of different people. And the nurse is responsible for being the team leader in that situation. So if you think you're a good leader and you think you're good at science, nursing might be a good career for you. So maybe I'll send you guys another video again. I guess that's it for this one. I hope you learned a few things and had a few questions answered. All right. Bye for now.